I'm seeing more and more incidences of traumatic stress. Traumatic stress is a normal response to something that happens terribly. The problem with saying that it's a normal response is the normal response is interpreted by you. What's gone on in your life? What kind of childhood did you have? What upbringing? And what other severe shocks or stressors have happened to you? I'm thinking right now about the Damar Hamlin when he had that terrible incident on the football field, and then he went into cardiac arrest, and all of these people were at that game watching. And I was able to talk to a couple who had witnessed that. One of the partners had witnessed it. And the fact that when he witnessed it, the way it caused him to react, and remember, it is a normal reaction to a stressor, was unbelievable what it did in the relationship. He was terrified, he shut down, he withdrew. Now, all of these in that scenario were a normal reaction. However, what's not normal about traumatic stress is you don't know how long it will last. You don't know your partner's history. You don't know what kind of chaotic childhood they grew up, what other traumas that have occurred in their life. And so you as the partner are trying to help them, support them, but many of the symptoms will look odd and scary to you. So I want to go through common reactions and responses to trauma, just so you'll have a baseline in being able to support your partner. And if you are the person going through traumatic stress, you will kind of have awareness of what you can anticipate. Intense or unpredictable feelings. And once again, these can be anxious, nervousness, overwhelmed, grieving. In this incident I'm telling you about, the guy would just start crying. And it was leftover grief from long ago, I'm sure, from his childhood. But because of what he saw and the sadness of that incident, it just got heightened during this process. Changes to thoughts and behavior patterns. The relationship might have been very stable before. Now, all of a sudden, it might become unstable. One of the partners who saw the traumatic incident happen, they may actually start saying, well, none of us are here forever. We don't know what's going to happen. Or they might turn into someone like very hypochondriac, like they check everything. If it was an incident they saw where someone had a heart attack or someone got hurt, they may try to take control of that by taking control of their own health. Sensitivity to environmental factors. They may be out with you for a coffee or something and react severely to someone in the coffee shop, or something they smell, or just cars going by outside the coffee shop. All of a sudden, these things can take on a new meaning, and it's intense. Strained interpersonal relationships. They may turn away from loved ones, from family, depending on what the stressor was that caused the reaction, the traumatic reaction that they had with it. It also matters when you see the incident, the traumatic stressor, how close you felt to that incident or how relevant it was. They may have stress-related physical symptoms, may not be able to sleep, may have terrible headaches, they develop gut problems, they have all of a sudden they have an ache, they're limping. All of these things would be in the realm of a normal stress reaction to trauma. Okay, so how do you cope with it? How do you cope with it if you're going through it or if you're the loved one of someone going through it? Well, first of all, you want to encourage the person to lean on you. You want to encourage them that you're there for them, that they're not alone in this, that this is a temporary situation, and you do want to say that. You're going to help them get through it. As much as you can offer that, you want to do that. If you're the person going through it, then by all means, start leaning on loved ones. Start opening up. Tell them what you're going through. The more honest and candid you can be, the better they're going to be able to help you. Face your feelings. If you're feeling something, whether it's sadness, grieving, you're feeling like, your body's having trouble, you can't digest things, you have a headache, or you're feeling incredible depression and anxiety, talk about it. Do not stuff these feelings. These feelings are just feelings. They're not right or wrong. They have to come through. The more you can catharsis them with talking about them, the better able you're going to be able to move through this and heal and prioritize self-care. Take care of you. If you don't feel like being out in a crowd for a couple days, then by all means, stay in. If you feel like you need a massage, maybe your body is really aching, you're not sleeping, go and get a massage. Do the things for you that you need to do. Sleeping is going to be a problem, so as much as you can, catch up on sleeping with cat naps during the day, when and if you can. And lastly, be patient. This usually is a very temporary thing. It lasts maybe 2 to 4 weeks. So it's not going to last forever, but it's going to matter how you go through it. If you stuff everything, this kind of a trauma can last for 6 months to a year, and it can reoccur, and you don't want that. Go and get help. If it doesn't go away for sure by 1 month, then go and seek help. What kind of therapy is going to help? Well, if you do it right away, the psychological first aid is going to help. And that's when a psychologist is just going to put you through some things where they're going to talk about it. They're going to tell you, why it won't happen to you. They're going to reassure you. They're going to validate you. Things like this, they're going to process your feelings with you. That's the first aid part. These counselors are really good at getting to the heart of the matter quickly. They work with Red Cross, they work with other disaster teams. They're used to that and they are good at it. Secondly, you can find a therapist for cognitive behavioral therapy. All you have to do with that is ask a therapist that is on your insurance plan, or a therapist you find, if they also do cognitive behavioral. Most of them do, and they can help you with that. Also, you could talk to a therapist about finding a support group that deals with trauma-based incidences, because the more you're with other people that this has happened to, and the more you're able to talk it out, the better it's going to be for you. Lastly, if you can't find anything else, then try online therapy. Online therapy can help you catharsis it, get it out, talk about it, set up a goal plan for you. All of these are going to be very helpful in helping you move through it. You're not crazy, you're not abnormal. This is a normal reaction to a severe traumatic stressor.